So welcome Dr. Minal. Before we begin, I would like that please introduce yourself to our audience.
Yeah. So I am Dr. Minal Chandra and I am a practicing pain physician. And so during the course of the podcast, we will be discussing what is pain physician and what is pain medicine all about. And I'm the co-founder of Epione Pain Management Center. And Epione Pain Management Center is India's biggest, largest chain of pain clinics. We are spread across five branches in almost 3 cities. And we have treated more than around 75,000 in all our centers. And our specialty is regenerative medicine. So I'll be talking about all those things.
So let's start with what pain medicine exactly is.
Yeah.
Is it a part of NMC curriculum?
Yeah. So pain medicine is basically a part of anesthesiology. Okay. And anesthesiology is, of course, under NMC curriculum. And our national medicine curriculum says that every anesthesia department should have a pain clinic. Okay. So now this is there since long, but now the pain medicine branch is coming up it's, individual entity. Pele it was with anesthesia and people were not knowing much about it. But now we have clinics which are individual standalone clinics where we only practice pain. So this is well within the curriculum of anesthesia under NMC, and we deal with all types of chronic pain. So chronic pain means any degenerative condition, whether it's a shoulder pain, knee pain, arthritis, migraine, headaches, back pain. So every pain basically will have a reason, right? And we identify those reasons and then treat it.
Yeah. So if somebody wants to be a pain physician, so what step she or he should follow?
See, first thing is you have to do your MBBS, and after you have done it, then you have to do your master's in anesthesia. And then once you get the degree of anesthesia, you are a pain physician, okay? But again, because pain medicine itself is a special, very different from anesthesia, we do need certain amount of training. So we have lots of fellowships in India and abroad as well. And accordingly, then we will be trained there and then we can start our own pain clinic.
So there are often debate about the chronic pains. Is it really there or it's just in our mind?
See, in India, we have almost, not only in India, globally, 30% of the patients or the population is suffering with chronic pain. So it's true, it exists, okay? It's not only in the mind. And chronic pain is something that, most of the time we think that patient does not have pain, but it's just in the mind, and the family members are so pissed off with someone saying the pain, and they say, no, I don't think they have pain, but they keep on talking about pain. No. The first rule for us when I came to Hyderabad to learn pain medicine, what my mentor taught me, the first thing was, if a patient tells you, I have pain, that means you have to believe that patient is in pain. Okay. So pain do exist, physical pain do exist, and it's not myth. And it's so debilitating that the quality of life gets hampered. We are worried about diabetes, we are worried about hypertension, we are worried about cancers. But the most common condition which disable a person is chronic pain.
So now you are dealing with chronic pain. So what kind of patient do you see on the daily basis?
See, mostly it is knee joint pain, arthritis. We know how common it is. Then frozen shoulder. We get back pain. Back pain is real, cause of pain in the society. Neck pain. Then we have sports injuries, gym injuries. We have migraine, headache. Headaches also is a big issue. Yeah. And most of the time when we talk about headache, it's not only migraine. There are so many other types of headaches. Okay. So the neuralgias, then we have intercostal neuralgia, we have trigeminal neuralgias, other peripheral neuralgia. So many conditions like this which actually exist on a day-to-day basis.
Okay. So is it a short-term treatment or it will take a long-term also?
See, when you want to treat any type of chronic pain, you cannot have a short-term treatment because this pain exists since long. And it's multifactorial, okay? Like I said, it's not only physical, there are so many other issues also. So suppose a patient of chronic pain is coming to you since they have been suffering since long. So there are so many changes that will happen in the body. There are things like sensitization that happens. There are yellow flags, when patient starts overthinking, it is associated with anxiety. Patient starts thinking, why me? Why pain is not coming down? I am taking tablets. the joints are weak, the muscles are weak, so we need a physiotherapist. Then the social life is hampered, the relationship with the spouse, the relationship with the family members get hampered. So we need some therapist, we need counseling. Then, the work at workplace, they're not happy. So we need to get them back to work. So occupational therapist is required. So it's like a multifactorial thing. And when we are working on such a multidisciplinary way, it has to be long term. So, in very rare cases, I can say that the chronic pain can be treated immediately. But if you want to get rid of chronic pain for very long time in a permanent basis, it has to be a long-term solution.
Okay. So nowadays, this regenerative medicine is a very famous word. So it is a new in India, or it was from a long time?
So in India, it's there, obviously, because we have so many literatures which has been published 2-3 decades back also. But now we understand the need, we understand the way it has to be done, and we understand that, we now can bring regenerative in a way that can be useful to every patient. Okay. So what is regenerative? By name only, it means that, we are regenerating something. So what we are doing here is whatever tissue has been damaged, we are trying to replace it, regenerate it, regrow it, and, repair it. So that is what regenerative medicine means. So mostly previously it was used for hair, for skin, but now what we have realized that, in joints, when it gets damaged, when the muscles are torn, when the ligament injures, especially in sports, in gym. So we don't need to go for surgery for everything. Okay. And regenerative, using your own cells, our own cells have so many potential, so much growth factors that now, because of the science behind it, we are now able to isolate those cells, process it, and then inject it, and then we can use it for a natural repair.
So from anesthesiology to pain management, what exactly you do on daily basis? What your role is?
Yeah. So in anesthesiology, basically what we are doing, we need to give anesthesia to the patient before surgery. Okay. Then slowly the scope of anesthesiologist expanded, and then we started taking care of the pre-op checkups, and then, into the post-recovery till the patient is recovered well. Then again, our thing expanded, and, then started acute pain services. So, now the epidurals have started. Okay. You know how in Western countries, epidural for normal delivery is very common. Though in India, it is not that common. But now you see, if you go to corporate hospitals, epidural is a part of, normal delivery. So that came into our department. And then again, it expanded into managing chronic pain. So like I was explaining that we do, lots of interventions like injection techniques, regenerative medicine, nerve blocks, radiofrequency ablations. So all these are like non-surgical, minimally invasive interventions which are done as a day care procedure, and maybe sometimes in a multiple settings or sometimes in a single sitting along with other modalities. And that's how anesthesiologist to pain services has expanded.
So these kind of injections are safe?
Right. If done properly, yes, these injections are really safe. Before so many things were done blindly. You understand, we not had machines that can give us a real-time image and, where my needle is going, am I at the correct place or not. So now we have ultrasound, we have fluoroscopy, real imaging is happening real-time. We can see where my needle is going, and we have now trainings available. So, yes, I can say that, it's almost like 99.9% safe when it is done under image guidance.
Okay. So now the back pain is very common. So how do you evaluate, somebody needs a surgery or there is a better treatment after the surgery? So,
yeah. See, there are certain indications for surgery. For example, fracture hair. So obviously there is no non-surgical measures. Till the time surgeon thinks that, okay, fixing it with K-wire or something can help, or a slab can help. But in those cases, yes, if the surgeon thinks that surgery has to be done, it is mandatory. But for conditions like chronic degenerative conditions, okay, back pain is happening because you're aging and your disc is out, or suppose like arthritis is happening because when you're aging, the cartilage loss is happening. Frozen shoulder is happening because of certain uncontrolled diabetes or hypothyroidism. These conditions basically do not need surgery always. Okay. 90% of the time we can prevent it, and 90% of the time we can treat it without undergoing any kind of surgery. And any degenerative condition or chronic condition, like I said, does not happen over a day or does not happen over a few months. It's a prolonged thing which will be happening over a few years. So we cannot immediately treat it and needs a holistic multidisciplinary approach. But yes, these things 90% of the time can be taken care of without undergoing the knife and any surgery. And we can take care of through interventions, minimally invasive procedures.
Okay. So like normally when you go to OT, what kind of questions you are hearing from the patients on regular basis? Like what kind of fear they are having?
Okay. See, so the questions are different if the patient is posted for anesthesia or if they are posted for pain procedure. So for anesthesia, obviously, when they are going to, what type of anesthesia they are going to get, and when they will come out of anesthesia, can they eat immediately and all those things. But when we have a pain procedure, the questions are different. Is my pain going to be completely gone? How many days I need to take bed rest? And, can I go to my work immediately? Is it going to harm me? So these are the questions usually what patients before a pain procedure will be asking.
So like if somebody is having pain and usually they are going to physiotherapy or a chiropractor, so what's the point when they should go and see for an anesthesiologist or a pain physician?
See, when patient is having pain, back pain, if it is acute, by acute I mean that it is a few days, okay? And if you rest, the pain goes off. If you take medicines, the pain goes off. Or it's just a spasm, you can manage it through physio or tablets and all those things. But if your pain has become chronic, so what I mean by chronic is if it has become more than that of 3 months, so that is when we call it as chronic. That is the time when you need to actually find out what is the reason for your back pain. Now, most of the time what we think is my back pain is sciatica, disc prolapse, right? But there are almost like 50 causes of back pain which needs to be identified, because not all pain is because of sciatica or a disc prolapse. So who is going to diagnose this? Sometimes, your first patients with pain the first person they go to is physiotherapist, or sometimes they go to chiropractors, or sometimes they go to, here they also do go to Ayurvedic massages and all those things, okay? They're treating your pain, but they're not identifying what is the real cause of pain. So if your pain has not come down in 3 months, make sure you're visiting your pain physician, because we identify what is the reason. Okay, so there are certain tests we do clinically on the patient, and then if we require some kind of investigation like a X-ray or a MRI or CT scan, whatever is to be done accordingly, and then we confirm the diagnosis. Okay. So any back pain more than 3 months should never be missed, and make sure that you go visit a doctor who can identify the reason of pain, and then accordingly we can treat it. Yes, a lot of time just a good physiotherapy, lifestyle modifications do help in taking care of your back pain, but in 50% of the cases you need something more. Maybe it's some good antineuropathic, some good set of a group of pharmacology that may help. And if things are not helping, then again we have interventions. Like I said, in our pain medicine, we have minimally invasive procedures, we have epidural injections, we have nerve root blocks, radiofrequency ablations, and regenerative, which is very natural way. And then if in certain cases when patients have red flags. So what are red flags? Red flags is when you cannot, when there is a urine and motion incontinence, when there is weakness of leg, and when the pain is so excruciating that things are not working out, then you may have to go for surgery. But then going for surgery, the chances are out of 100 patients we see in OPD, it is 5 to 6 need surgery, and rest can be managed non-surgically.
Okay. So let's say now that a person is taking pain management therapy. So it is a one-time procedure, or should he or she take repetitive times?
No, mostly not that it is repetitive, but yes, repetitively they have to visit their doctor, because like I said, it is not just one injection is not going to do any kind of magic. It has to be in a holistic way. So there are multiple reviews, especially in our setup, in our protocol. We have reviews with the doctor, with the physiotherapist, and the occupational therapist, and all the members in our team. And then it takes, at least 3 to 4 months where we can say that, yes, my patient is now all right and healthy and good and back as he was or she was before.
So like nowadays, everybody is having some kind of pain. Either it's back pain, either it's neck pain. So there are any ways, if we are not going to any physiotherapist or any doctor, and we can cure it without medications? Is that possible?
Yeah. See, right now, the most common cause of back pain is mechanical back pain, which is happening because of wrong posture.
Okay.
The way we sit, the chair in which we are sitting, the number of hours we are sitting, the lifestyle that has changed, because we are moving from sedentary lifestyle, and then suddenly, especially in IT workers, you see throughout the week they are working in the office, sitting in the same chair for long hours, and then on the weekends they go for trekking or some kind of sports. So it's just like, from one end to the other end, right? And then we are so much dependent on junk foods nowadays. Second thing is smoking. Okay, smoking is something that is really, really dangerous for your spine, because with smoking, what we think is it's cancer. We all know that smoking is proportional to cancer, but what we don't know is smoking also causes back pain. Okay, and current smoker or a passive smoker, active smoker, or someone who has left smoking, at some point of time they all will suffer with back pain. Okay, so smoking is one thing, which needs to be taken care of if you're suffering with back pain. So all those things, all these changes when we make into our system, definitely these back pains, neck pain is going to be taken care of. So lifestyle modification, going into active, active lifestyle, starting your days with any kind of exercises, whether it is swimming, whether it is just a walk, or whether it is stretching, straining exercises. Start your day with that. Make sure that you're active throughout the day. Make sure you're hydrating well yourself, because we keep on sitting in the AC room, and then the dehydration is even more. So you hydrate yourself. You take continuous breaks in between, and then smoking, like I said, has to be definitely taken care of, and food habits needs to be taken care of. So if we're taking care of all those things, back pain in 90% of the patients, especially in young people, can be taken care of.
You mentioned that smoking is also related to back pain. So like how is it?
See, when we hear of smoking, what we think, the smoker is like, directly proportional to getting the chances of cancer. But not all smokers will get cancers. Okay. But definitely all smoker at some point of time will have back pain. Okay. So whenever in smoke, whenever you take that cigarette packet, it is written injurious to health and cancer and all those things, but no one mentions about back pain. And back pain is the most common reason, where it is the most common cause of your disability, most common cause of loss of work. Okay, and smoking being one of the reason, which is a modifiable factor, we can easily do it. So smoking, not only for preventing yourself from cancer, from preventing yourself from back pain, you have to quit smoking.
Okay. So nowadays people are taking too much painkillers. How it is affecting our health?
Anything that we take orally, okay, painkillers or any kind of tablets, even if it is safe, we say paracetamol is safe, but if you take too much of paracetamol itself will have its own side effects, right? So any painkiller is not safe. Most of the time painkillers will have effects on liver, effect in kidney. Acidity is one of the most undervalued symptom of painkiller, and because of that acidity, lots of gut issues and all those things will happen. So in any form, anything which is too much of painkiller is definitely going to damage your body. Yes, there are few painkillers which can be safe, which does not affect your kidneys and your liver, but in long run they are also going to harm you in some or the other way. Now there are so many other things before opting for painkillers, like I said, lifestyle modification, making changes in your food habit, hydrating yourself, all those things can act as a painkiller if you do it at proper time, and if you do it, once you have understood that what's wrong happening in my body.
So recently President Donald Trump also said that don't take Tylenol, as we known as a paracetamol. So are you convinced with his statement?
I may not be convinced with Mr. Trump, but definitely yes, like I said, anything of too much is not good. And paracetamol in long run does affect liver. Too much popping of paracetamol for any small pain, for any headache, if she's not feeling good, if she's feeling tired, she used to pop off paracetamol. So it can be linked to any kind of cancers in future also.
So there are any habits or lifestyle changes we can do so we can eliminate these kind of pains?
Yeah, like I have been telling throughout that, lifestyle modification is the most important thing which we need to do. And in that, the most important thing is moving out from a sedentary lifestyle, okay? And when I mean by sedentary lifestyle is, continuously sitting on your couch or continuously sitting in front of your desktop, working. Even for us also, we are sitting in our OPD, working continuously. And that is what a sedentary lifestyle, okay? So we need to have activity. Our day should start with exercises. The joints should be mobile. The muscles stiffness should be reduced. So going out, meeting with people, socializing is also a kind of, where we are coming down with our stress. So definitely sedentary lifestyle is something that we need to work on. Second thing is on the type of food we are talking, because even though we think that, we are having, we just ordered a good food from outside, but those are outside food. The oil that has been used, the products that has been used, the hygiene of that product, we don't know. And there are so many environmental changes has happened. Okay, the product that has been grown, the pesticides and all those things. So all those things are contributing to, the type of food, the things which are going inside our gut. Then again, what kind of gut we are into, because we need good bacteria, right? So the change in the food habit, the change in the water, and then we have seen that there are so many people who, for work, they move from places to places. So all those things keep on changing. That is going to affect your body in a very bad way. So you need to keep a balance between that. And once your body in stress, the most common thing that it will present is with pain. Okay, so you will have some kind of vague pain in the body, you have severe back pain, sometimes calf pain. You must have seen a lot of middle-aged females with calf pain. Okay, so all those things are because of the lifestyle changes that is happening. Okay.
So usually people don't know what anesthesiologists do. Like they are just thinking that they are just giving some kind of injection.
Yeah.
So if you want to elaborate for this field, what do you want to say?
See, in anesthesia, like I said, yes, we do give anesthesia in form of injections, and then we have different form of anesthesia as well. But it is not limited to that operation theatre. It is giving a proper anesthesia to the patient, making sure that, patient is deep in sleep during the anesthesia, because we don't want the patient to know what's happening during the surgery, because it is very traumatic. So a deep sleep during the anesthesia and patient is not aware of. Then getting back that patient to normal life again, smoothly. We have to, make sure that smoothly the transition is happening from anesthesia to awake. Then in the post-op recovery, we have to make sure that things are good. Patient is not much sedated, patient is able to breathe, patient is able to pass urine, patient is able to walk. We have to make sure of that. Is this part of anesthesia? Okay, so from pre-op to post-op till the patient get discharged is what an anesthesiologist does, and it's not only making the patient sleep in the OT.
So like if a patient is coming to the OT, so they have a lot of questions. So how do you ensure them, and what kind of questions they have before the surgery?
Yeah. So basically, the best part is that, the anesthesiologist would have met the patient before, because we need to do the pre-anesthetic checkup. So during this time, we interact with the patient and we know, so patient is familiar to us, okay? So that is one thing, that the anxiety is not there the next day. But most commonly, what they want to know is how long the surgery is going to last, and what kind of anesthesia they are going to get, and when they are going to be in the senses back, and all those things. So these are the things which we do explain to the patient, that sometimes when we tell that, we are going to give an injection in your backbone, we explain them that this is going to be the procedure. Sometimes when we have to give a general anesthesia, we need to put a tube. We tell the patient, so this is the procedure. First, we will pre-medicate you, then slowly we'll pass a tube, and you'll not be knowing anything. So all those things is definitely in our curriculum, where we need to explain this to the patient. And the most important thing is to make sure that the patient is not anxious at the time of surgery.
So like there are so many things people are thinking for the doctors. So any certain kind of myths you want to burst, like people should know about the doctors?
See, first thing is, because I am into this field since long, and I have my, seniors, super seniors, my friends, my colleagues, juniors coming into medicine. A doctor will never have a bad mind or a bad intention. Okay. And whenever people say that, we are making money out of it, or, we are prescribing unnecessary tests, they need to understand that it's the requirement. Sometimes we need to diagnose with certain tests. Sometimes we need to make sure that, we are not missing out on any diagnosis. And that is how, and that is where, it's difficult for us to convince the patient also, because they have been going to multiple doctors, they have been taking multiple opinions. And for a condition, there can be so many things that two different doctors trained in the same specialty can think differently, right? But the thing that, that's out in the general public is like, we have become greedy. The medical profession is not good. Now our intentions are not good, but that's not right. I don't think I have met any doctor in my life whose intentions are not good. If you lose a patient, I'm 100% sure if you lose a patient, you are going to think about it, you're going to read about it, you're going to run to your seniors that what wrong did I do, or somewhere you're going to blame yourself. And, you will make sure that next time this is not going to happen. So, if you lose a patient, it is not only that, it's patient loss and doctor's loss also. So, do not think bad about doctors. Truly, those who are doctors practicing medicine cannot have bad intentions. Those who are quacks, those who are not practicing medicine people, definitely they would think in terms of money. But I don't think doctors will have that bad intention.
So how you decided, like now I've decided I'll become an anesthesiologist. What was your turning point, or let's say who inspired you?
To be honest, nothing inspired me to be an anesthesiologist. It was just the rank that I got. And I always wanted to opt for some surgical, branch, but unfortunately I could not make it. And then I had to do my anesthesiologist. For 1 year, I missed out on anesthesiology, but unfortunately the second year also I had to take that, and so I took it. I finished my post-graduation, and then luckily I got that opportunity where I can get into pain medicine. So now I'm happily into pain medicine.
So till now, like from 10 years, more than 10 years, you are practicing medicine. So have you ever feel like unsafe? Because we are hearing every day the incidents with the doctors. So have you ever feel that should I left the country, or what should I change it? Something like this?
See, when you are into this profession, you're practicing as a physician in India, you never want to go outside, leave the country and practice, because what we can do here in India, we cannot do outside. Okay. Definitely, maybe the working condition may be better, or the challenges may be less. But here in India, you can do whatever you want to till the time, you're doing it in a protocol manner, till the time you're licensed to do things, and till the time you have all your licenses in place, you're free to do whatever you want to do. But again, when we move to other countries, we always have to be under someone. We have to keep on proving ourselves, and, we have to have certain limitations. So as a doctor, yes, the situation in India where, people thinking about doctors are not so good, but there are people who understands things, and they understand what's happening in healthcare. There are some lacunae in healthcare, which needs to be overcome. But I myself personally I think I'm in the best place right now.
Okay. So like nowadays, we have seen that in corporate hospitals, if a pregnant female is going, then there is a lot of chance, even more than 70 to 80%, then she will have a C-section. And it is increasing every year rapidly. What is your thought on it?
See, my basic thing is anesthesia, right? So as an anesthesiologist, I have seen a lot of patients, lot of time, when we have been called for emergency cesarean. Okay. So while our PG also used to think, oh, again, there is an emergency section, because we'll have an emergency, most of the places will have an emergency room ready for the cesarean cases, because it can come anytime. Yeah. Okay. But 99.9% of the time, I have not seen where it has been done just because it has to be done for money. You don't understand what is the importance of bringing the baby, crying baby alive and taking out. That only the operating surgeon, the assisting surgeon, the nurse, the anesthesiologist and the pediatrician who have come to, attend the unit can only understand what happiness we have, when we have posted a patient for emergency section and the baby comes out crying. Because no one can understand what is a fetal distress or a meconium stained baby, or no one understands that, even if we are delaying it, the risk, what are the risks? And especially in today's generation, when every baby is a precious baby, right? Even that 1% chance of bringing that baby happily in the world is there, I think, then it should not be questioned. You don't understand that how many times, just because of the delay in the time, or just because of the delay in not operating on time, we see a lot of babies going into distress, or we are not able to recover them. Okay. And I don't think any surgeon or any gynecologist, just for few thousands, will put a patient in this condition. And whenever there is, see, I'm an anesthesiologist, I know when there is a fetal distress, once I have given the anesthesia, I just have 3 to 4 minutes, and the surgeon just have 3 to 4 minutes to, to cut all the layers of the mother, get the baby out, and then you have to repair the uterus. No one can understand that. It is only the surgeon who is operating on her can understand, that you have to convince the patient, you have to convince the attender, then you have to inform the anesthesiologist, you have to inform your team to keep the OT ready. The anesthetist should come, give the anesthesia. The anesthesia should be proper, and then they have to cut 5 to 7 layers to get the baby out. All have to be done within 15 to 20 minutes. Okay. So I don't think anyone except for medical professionals can understand, and this is extremely wrong. When patient says that, for few thousands we have put on going for a section, this is wrong. Last minute section actually is because of fetal distress or some kind of emergency.
So we have talked about a lot of this stream. Now I wanted to ask, you have set up your clinic almost 10 years ago. If somebody wants to set up today, how much it will cost?
Yeah. See, mine is a pain clinic, right? So we need certain instruments, and we need a good place. We need a multidisciplinary team and all those things. So somewhere around, including all the machines and all, somewhere around 1 to 1.5 CR is what we require to put up a setup. Okay. To give a good setup, where we have all the facilities, where patients once walk in, they can get all the treatment done, all the diagnosis done, and then they can walk out.
Let's say somebody completed his MD in anesthesiologist, and now he wants to practice in a hospital, and he decided to open a center. Then what is the salary of one is doing the hospital and one is having their own setup?
Okay. See, for anesthesiologists, we have different kind of practices. So there are freelancers. Freelancers means you go out with the surgeon and, you can earn. So freelancers do earn around 25, 30, sometimes even because the males, they can go easily, they can come up late and all those things. They do earn up to 40 to 50,000 per day. Okay. If you're working in a setup, in a corporate setup, then depending upon your, number of years you have worked and all your skills, maybe somewhere around 1.5, and the senior most can be getting up to 5 lakhs, 6 lakhs also. And in majority of the corporate hospitals, even the anesthesiologist, if they're part of the surgeon's team, they must be getting some incentives as well. But as compared to other branches, surgical branches, definitely the anesthesiologist earn a little less. If you want to move to pain medicine, Initial years will be a struggle, definitely, because pain medicine is just like sitting, running your OPD, trying to get the patient, doing the interventions. So initial few years can be, a little bit of struggle. But once you have your own skill and you have made your good if you have made your good patient base and your treatment is doing well, then you have a good word of mouth, then definitely you're going to earn good amount of money.
So like how a normal day looks like in your life?
So my normal day is like to get up early in the morning, then drop my daughter to school, then go to a hospital, and then the day starts with the chaos. And then, by the time I wind up, it is around 7:38 with the chaos. And then, we need to keep ready things for the next day. So my whole day goes into hospital from morning to evening.
Okay. So like how many patients do you see or how many OTs you attend in a day?
OPD, so we are a huge team. And we have we have 4 to 5 doctors in one center. So we have our OPD every day. What we see is somewhere around 30 to 40, sometimes even more. And procedures also, we do a lot of procedures. Like we do somewhere around 25 to 30. Like on Saturdays or Mondays, it is going to be a little bit more.
Okay. So like if somebody wants to visit Dr. Minal, where like they can find you?
So they can find me in Epione Pain Management Center. We have our branches in Hyderabad, Jubilee Hills and Dilshuk Nagar. We have one branch in Chennai at Egmore. We have 2 branches in Bangalore at Banshankari and Sehkar Nagar. So these are my branches and I am at Jubilee Hills, Hyderabad.
So let's start the rapid fire round. You have to give the answers in 5 seconds.
Okay.
So one anesthesia myth you hear all the time.
That anesthesiologists are mostly on phone.
Okay. Coffee or sleep? Which do you rely on more before an early surgery?
After a binge watch, a good sleep.
What's the most common fear patient express before anesthesia?
That, they have to be, empty stomach for a very long time.
And one thing you wish every patient knew before coming in?
That, the anesthesiologist will take care of them and they will put them back safely.
If pain had a personality, how would you describe it?
Maybe like Mr. Trump.
Which is more challenging for you, anxious patients or sleepy ones?
Definitely anxious patient, very difficult to handle. And, we need to keep on talking, counseling to bring down their anxiety.
Your go-to stress buster after a long day in the OT?
Maybe a good cup of tea and some binge watch Netflix.
Your favorite memory from college?
So my favorite memory from college is late night sitting on the stairs, eating matris, chit-chatting. Then the warden used to come, warden used to, then scold us and then send us back to our rooms. So that used to be during our MBBS time.
A common mistake people make about back pains?
Back pain, that most of the time they think that, back pain can be self-limiting. But no, I've seen patients who think it's self-limiting and then they land up to a condition where they have to go for surgery. So do not think that it's always self-limiting. Seek help if when required.
Let's suppose if you are not a doctor, then what you want to become?
I don't know what I want to become, but I always wanted to be a doctor and I'm happy doing it. But recently I also discovered my quality of being a lawyer. So because, there are some things happening where I need to justify myself. So, I found myself that, I could have been a good lawyer.
Yeah. Nice. So thank you, Dr. Minal. Thanks a lot for your time.
Thank you, Dr. Garima. It was nice talking to you.
Thank you.